Assalamu alaikum everyone. Our seminar today is maxillary sinus diseases and it is in relation to the oral surgery by me, Fadia Anmar and Fatma Ahmed. Introduction. Maxillary sinuses are air-containing spaces that occupy the maxillary bone bilaterally. It is the largest of the paranasal sinuses. Maxillary sinus is described as a four-sided pyramid with the base lying vertically on the medial surface and forming the lateral nasal wall. Apex extend laterally into the zygomatic process of the maxilla. The upper wall or roof of the sinus is also the floor of the orbit. The posterior wall extends into the maxillary tuberosity. Anteriorly and laterally, the sinus extends to the region of the third bicuspid or cusp teeth. The floor of the sinus forms the base of the alveolar process. Clinical examination of the maxillary sinus. First of all, we do inspection. Nasal discharge may be evident during the initial evaluation. The next step we do is palpation intraorally on the lateral surface of the maxilla between the canine fossae and the zygomatic buttress. 4. Taping of the lateral walls of the sinus externally, although the prominence of the cheekbones may be very tender to the gentle tapping or palpation. And transillumination of maxillary sinuses. A radiographic examination of the maxillary sinus. We have two radiographs, intraoral radiographs and extraoral radiographs. Intraoral includes periapical X-ray, occlusal view, lateral occlusal view, and extraoral radiographs includes OPG, Waters view, submental vertex, and each one has its picture below it. Other radiographs we have are MRI and CT scan. Lesion of maxillary sinuses. We have non-odontogenic lesion and odontogenic lesion. Non-odontogenic lesion, it is inflammatory disease including infection and allergic reactions that can cause hyperplasia and hypertrophy of the mucosa. Number 2, we have neoplasm. Odontogenic lesion, we have maxillary sinusitis and it is two types, acute and chronic. This figure shows us the symptoms of sinusitis and its treatment. Symptoms include green aureolar mucus, sore throat, toothache, nasal congestion, pressure or pain in face, while treatment includes saline nasal drops, antibiotics, removal from chemicals and cigarette smoke, warm compresses, and therapy. Diagnosis and treatment of chronic maxillary sinusitis. First of all, we have a cladual lock procedure, and this figure shows the procedure. This figure 2. Arthroscopy approach, traditional technique in which the osteometal area can be evaluated and opened. The opening for more dependent drainage into the nose, termed an arthrostomy, can be created near the floor of the sinus. Endoscopic approach is a less invasive, newer techniques, allow exploration and surgical treatment of the sinus endoscope. Complication of oral surgery involving the maxillary sinus. We have displacement of teeth, roots, instruments, foreign fragments into the sinus. Number 2, creation of a communication between the oral cavity and the sinus during surgery. Removal of the roots and broken instruments. The roots and broken instruments that dislodge to sinus may be found either below the sinus membrane directly, which is between the membrane and a bony wall of the sinus, or within the sinus membrane. This can be felt by during movement of the head or by serial X-ray. Foreign body of endodontic origin in the maxillary sinus shown in this video, in this photo. Extreme care during exploration so that not force or push the object within the sinus if feel that it is located just below the sinus. The sinus needs to be opened through a cladual lock approach and the object retrieved. Oroantral communications, immediate treatment. This photo shows the oroantral communication.